Hi, my name is Rhett Hallows. I specialize in adult reconstruction, which is joint replacement, and I work at EmergeOrtho. ABMS stands for Anterior-Based Muscle-Sparing, and it's a type of approach that we do from the front of the hip, so it's similar to a direct anterior approach. And the real difference really is the interval that we get down into the hip joint. So we're just a little bit on the other side of a muscle in the front part of the hip. It allows us to access the hip very easily and still have the same benefits of an anterior-based approach. Quicker recovery, generally shorter length of stay in the hospital, less pain med use. So it's a really good approach that I've been using for 12 plus years and get really good results. Muscle sparing, I think the benefits of an anterior approach, and specifically this one when we're talking muscle sparing versus kind of standard, what most people consider a posterior approach to the hip. When we use this approach, we're able to go through the natural planes in the front part of the hip. And so we don't really cut down any muscle or go through any muscle. So when we say muscle sparing, it really means that we're able to get down to your hip joint through your natural muscle planes and do the surgery without disrupting muscle attachments. What early recovery looks like with ABMS is, we get people up and get them moving right away. A lot of the hip replacements that we do are done outpatient, so we're able to get people home the same day of surgery. People generally still do use some assisted device early on, whether it's crutches or a walker. I prefer crutches, but just from a pain perspective, they're going to want to use those to offload their joint a little bit. But we have people up and moving right away. We want you up and walking 2 or 3 times a day, doing your PT exercises 2 or 3 times a day. I do think that with the ABMS approach, I think early recovery is quicker. I think that your ability to get up and get moving and come off your crutches and how much pain med you use is definitely improved compared to kind of traditional hip approaches. Generally by 3 to 4 months, if you look at big data sets, there's really not much difference as far as patient outcomes go and how they feel. But I think that early recovery to where they get up and get moving generally tends to be a lot quicker with the ABMS. I started doing this 12 years ago. I moved from Utah back to North Carolina, and one of my mentors, Scott Kelly, trained me on the approach, and I've been doing it since then. We have developed it to the point where now teach it both nationally and internationally. It's just an approach that I think is really nice for patients and lets them recover really quickly, and it works really well. At EmergeOrtho, they have a large group of physical therapists that can help out with patients. They have a lot of points of access, so it's really easy for them to get in and get their care that they need. But then also when you talk about the surgery part and the recovery part of the process, the facilities that they have are really top-notch. They really care about patient care, and they do a really good job with patients in the hospital, in the surgery centers where we're doing our outpatient surgeries, to let those patients really feel like they're getting taken care of by really good people, and patients really appreciate that. And the difference that you see there is really remarkable in how patients appreciate what they get out of the care that they've had during their surgery in the outpatient center as well as in the hospital.